Good evening, everyone. Bienvenido. Welcome, everybody. This is such a wonderful occasion to welcome everybody to this very special presentation, which is being presented by BARP in collaboration with FCV Medical Facility, which is in Bucaramanga in Colombia. So this is really a special occasion. My name is Belle Holder. Thank you all so much for being here. This is really an important issue. I'm hoping that everyone is safe and well today. And this is definitely one of the ways that BARP hopes to keep you safe. Without any further ado, I will take this opportunity to say welcome once again to our counterparts in Colombia. And we'll hear now the welcome address from BARP's president, Ms. Marilyn Rice-Bowen.
Good evening all, and thank you so much, Belle. And it is indeed a pleasure for BARP to present this awareness session this evening. Dame Billy Miller, Vice President of BARP, Mr. Henry Barrow, Treasurer, Ms. Monica Hines, Mr. Henry Barrow, Secretary, Ms. Monica Hines, Treasurer, Directors, Honorable Lolita Applewhite, Tony Marshall, Eric Smith, Corinda Allen, and Professor Andrew Downs, other distinguished members of the Barbados Association of Retired Persons. We have a special guest here in our studio at BARP today, visiting from Imbanaca Clinic of Colombia, Dr. Maria Ferdinanda Valencia. And of course, we issue a warm welcome to our presenters from FCV Medical Complex, also of Colombia, Dr. Gustav Gomez and Dr. Maria Paula Barrera. Management and staff of BARP, members of BARP, and members of the media. I extend a warm welcome to all to this session this evening entitled The Impact of Falls, Prevention and Aftercare. The World Health Organization publication of April 26, 2021 states, and I quote, falls are the second leading cause of unintentional injury and deaths worldwide. Each year, an estimated 684,000 individuals die from falls globally, of which over 80% are from the low and middle income countries. Adults older than 60 years of age suffer the greatest number of fatal falls, end of quote. Ladies and gentlemen, fear of falling on occasions can lead to social isolation. Because if you feel that if you go on the outside, you're going to fall, you're going to stay inside. And if you feel that you're going to fall on your stairs, then you tend to stay in a particular space. There's also a very high cost associated with falls, particularly with aftercare. And for persons who do not have health insurance, it can cause you a major drain on your finances. This evening, I encourage you all to focus on the prevention of falls. We will need to, and notice that I'm saying we will need to keep our floors clutter-free in the home. We might need to rearrange furniture. We might even need to discard worn rugs. We have to look at adding grab bars in our bathroom and have our handrails and lights installed on the staircases. And you will know that on occasion, sometimes the handrail can become unstable. At the end of this presentation this evening, I am certain that you would make sure you stabilize that handrail. I'm also aware that some hard decisions will have to be made by yourself and our family members. It's always easy when you make them and not the family members make them for you. So therefore, I encourage you all to take heed, and because it's for your health and safety. Members and friends of BARP, this session this evening is to heighten the awareness of the impact of falls. So therefore, I encourage you to commit to change in your physical activity and prepare to rearrange, because we all want to stay steady. I welcome you all. And let's get our notepads out. I also want to state here that this session will be recorded so that if you think you've missed a major point and you want to play it back later, you can do so, of course. So ladies and gentlemen, welcome, the Impact of Falls.
Thank you so much, Marilyn Rice-Bowen. She is the president of BARP. And I think in preparing for this session, I was especially surprised in learning that according to the WHO, the World Health Organization, that falling is the second largest cause of fatalities, accidental fatalities in the world. It's just absolutely shocking. And interestingly enough, I remember, I'll share a personal story with you. I remember a little while back, I was having a problem with my knee and I went to my physiotherapist. And one of the things that she pointed out to me is that so often we focus on working out and getting healthier, building our muscles and all of that. But oftentimes we don't focus on strengthening our balance or our joints. And I was really surprised by that because honestly, it was something that I never thought about before. So it's really, really important. So I'm especially excited to hear directly from Drs. Barrera and Dr. Gomez this evening. I want to also let you know that at FCV Medical in Colombia, they are of course committed to saving lives from anyone, anywhere in the world. And for this reason, they want to give everybody in attendance today a virtual consultation. If you choose to take advantage of the opportunity, you'll only need to register your information so that it will take a few minutes. And if you look in the chat, everybody, I've already placed the link there for your registration form so you can take advantage of the free consultation. You're asking a little bit of information. It's all online. So if you take a look at the chat, I've already posted there the application form so that you can connect. So as a matter of fact, what I'm gonna do, I'm gonna click over and show you a quick look at what the form looks like. So I'm just gonna share my screen for a second and I'm gonna go over here. I hope everybody's seeing that. So it's a really simple form. It's all online. Is everybody seeing that with a nod of heads? That would tell me. Are you seeing my screen? No, you're not. Interesting. Okay. Okay. Are you seeing the form now? Are you seeing it? Not yet. Okay, well, all you need to do though, I'm keeping it really simple for you. All you need to do is take a look at the Zoom chat and click on the link that we've already provided for you there so that you can take advantage of the opportunity to have a direct consultation based on a consultation on orthopedics, oncology, or neurology with one of the medical professionals from FCV. Now, having said that, I'm going to take this opportunity once again to say bienvenido to our Colombian counterparts, Dr. Maria Paula Barrera, she's a general practitioner, and Dr. Gustavo Gomez, who is a specialist in orthopedics. So I will hand it over to you, Dr. Gomez, Dr. Barrera. Just remember to both unmute your mic so that we can hear you well and we can get started.
Okay, can you hear me?
Yes, we can.
Okay, María Paula, ¿empiezas tú? Do you start first? I think María Paula is going to start. María Paula? Can you hear me now? Okay, at first time, thank you very much for BARP and Barbados to invite us to this very nice event. I'm so glad to be here. I want to go to Barbados so near. Maybe in October, there's going to be an orthopedics event there, and I will be. I will be there. I want to know your beach and I want to know all your stuff there. I enjoy it.
We look forward to welcoming you. So please reach out to us at BARP when you arrive.
Thank you. Of course I will. Okay. Let me see, because Maria Paula is going to start first. Is Maria Paula connect? Because I don't see her.
Sorry?
Oh,
She cannot activate her microphone.
oh, she needs permission for activate the microphone.
Hello, can you hear me now? Hello. Hello, can you hear me? Okay, so let's start. Dr. Gomez, I will start and later I will leave them with you. So good afternoon, everybody. It is a pleasure to be here today. And as Belle mentioned before, my name is Maria Paula Barrera. I'm a general practitioner in the FCV Medical Complex, and I've been working for international patients since almost 3 years. And it's amazing. I love to do that. So today we are going to have this health presentation about a significant topic and something that we need to know about so we can prevent that it is falls. So the impact of falls. And we have a special guest that you already know, Dr. Gomez, who is one of our best orthopedists, and he's the director of the Institute of Orthopedics and Rheumatology are on our medical complex. So I just want to introduce first our complex. We are a medical complex and we have two different hospitals. We have Cardiovascular Institute, we call it FCV, and where we have a specialist in cardiology, hemodynamics, heart surgery, and everything related to the heart. We attend not only simple but really complex procedures. And we have the second hospital, that is Hospital Internacional de Colombia, HIC, where we have the rest of the specialties. And we have also three conform institutes that are the Oncology Institute, the Neurology Institute, and of course, the Orthopedics and Rheumatology Institute. It is important to mention that we are really interested about the safety of our patients. So that's why we have the Jci Accreditation, the Joint Commission International Accreditation. This is an international organization that measures some standards in the patient safety, and we are certified in both hospitals. We are located in Bucaramanga. Bucaramanga is a strange name, but it is our city. It is a medium-sized city, so everything is close. It is a safe city, and also the environment and the weather is really good for a patient to receive the treatment and to recover there. I also want to mention that we have an air ambulance, so we can receive any patient that we have from any country for a specific treatment, urgent specific treatment. And of course, we have an international office where you can go and receive all the attention you need, and we will be there to support you. So today we want to do this awareness section regarding falls, because as it was mentioned before, falls are a major threat for all people, and of course, specifically to older adults. As you can see, each year, 1 in 3 older adults that it is more than 65 years old experience a fall. And if you fall, you are after that 2 or 3 times more likely to have a fall again. So it's really important to know how to prevent and what to do if you have a fall. Okay, and we have some facts about the falls. We have some numbers here that we want to present. That it is that 1 out of 5 falls causes serious injuries. We usually see bones injuries and head injuries. So in this presentation, we will focus on bones, and most commonly what we have is broken bones, usually the wrist, the arm, the ankle, and the hip. And later in the presentation, you will learn a little bit about that and how dangerous it is, and also brain injuries, head injuries that are related to brain injuries. So as you can see, all these injuries can cause a lot of damage, and people can be affected in everyday activities and in their independence. Also, another number we need to know is that each year 3 million older people are treated in the emergency departments for fall injuries. So there's a lot we need to do to prevent. As Dr. Gomez will talk about this later, hip fractures are really important in this topic because more than 90% of this type of fractures are caused because of falling. And finally, as I mentioned before, we also have brain injuries that I think we can talk about this in another presentation in the future. So the next topics will be talked by Dr. Gomez. So Dr. Gomez, you can continue.
Thank you, Dr. Barrera. And we're standing by now to continue with Dr. Gomez.
Okay, we're ready. Can you hear me, everybody? Okay. Maria Paula, can you hear me? Okay. Well, Jose Maria Paula, we're living in a city called Bucaramanga. We're in the middle part of the highest in Colombia because we have our capital in Bogota is 2,600 meters of the sea, and we're 1,200 meters. So that's a good weather. We have a very, very warm place, and elderly people love that warm place. As you see in the United States, everybody goes to Florida when they're elderly. I think we have the same thing here. Elderly people of all whole country came here because we're a middle city, not too big, with a very good weather and with very good conditions in health, we have a very special place for health treatments of all the patients. That's why we have many more patients who are falling every day, and we have that kind of injuries so common in our city. Well, the conditions that contribute to falling most falls are common combinations of risk factors. These risk factors can be the social factors, the age factors, and the health factors in the patients. And they change when they're more elderly. If you are more old, you have more risk factors to have that kind of falls. Difficulties with walking and balance. It's because when you're older than 50 years old, that's too old, you lose the proprioception capacity. That's the how do you make a walk without thinking how am I going to use the walk? And that's a proprioception. This is like a sense, like ear, view, nose, everything. It comes automatically in us, but the people with come elderly lose that proprioception property. Chronic health conditions as arthritis and stroke, disease, or low pressure, blood low pressure can cause that kind of syncopes and difficulties in mobilizations. For example, in neurological disease like Parkinson included and Alzheimer can make difficult movement of the patients, and they can make falls every day. Vision problems. Actually, the vision problems are so common because after 40 years, that's so young people, they have the presbytia situation and they can make so focus in the eyes. And when you lose the capacity of make focus and you don't see that or you don't consult the ophthalmologist, you can fall because you can make, how is the distance between one and the next step? And you can fall down with the stairs, and you can fall down with irregular surfaces in-house or in streets or outhouse. The use of medicine like tranquilizers, sedatives, antidepressive medications, they can cause some need to make better walk because you can fall down at the take these medications, and you lose the balance at walk. Foot or poor footwear. Normally, the family believe the best shoes for the grandpas are the shoes when I buy for me, and they're gonna buy some expensive shoes, sneakers shoes, and they given to the grandpa, and the grandpa and the grandma can use the shoes because they're comfortable, but they can make sometimes the capacity of make them a good walking because they're so high or so flat. So you have to give the old people shoes related with the capacity of mobilization of them. That's why people doesn't know that. And actually, the shoes have some use capacity. Normally, when you're gonna buy a shoes, you don't ask, okay, how long can I use these shoes? But you can check this information in the websites. Are big companies can tell you, okay, these shoes are making for use the next. It's like distance 2,000 kilometers, and you have to know that thing to buy the shoes, especially for elderly. Environmental hazards can make dangerous, like well, I said, broken or never steps at home or outhouse. Rocks or dirt can be dropped over. The poor lighting especially, it's a very dangerous, especially at home, because after midnight nobody let lights on at home. It's not common, and the grandpas at homes can fall because they doesn't see, they don't use the glasses, and they going out to go to the bathroom at midnight in the darkness, and they fall. Lack of stairs and railings too. Lack of grab bars outside the tub of shower. That's, you have to use that always. when you have people elder than 60, 65 years old. Behavioral risk factors like inactivity or alcohol use. It's so similar than the people who use medications for depressions or anxiety, all that stuff. You have to be careful with that. Next slide, please. Okay, how do you prevent falls? After you have always you have to talk to your doctor or pharmacist to review how about the medicines we are taking to your grandpas. If any might make you dizzy or sleepy, always medications for pain treatment like inclusive acetaminophen or paracetamol can make combinations with some medications who can make the people sleep. And that's a very, very high risk in elderly people. Ask your healthcare provider about taking vitamin D. Vitamin D is the new molecular spectacular, works for everything, and we're using a lot. And it makes some improvements at the balance in the walking of the patients. And you have to ask the doctor if you can give the vitamin D to your grandpas. It works good, and we have some experience about it, and it's good, really. Do exercise that make your legs stronger and improve your balance. Simple activities, source and walking and dancing, especially training programs, works very good for elderly because they can much better the proprioception, what I told you 1 minute before. And well, Tai Chi is a good idea, but you can have Tai Chi experience everywhere. Always works very good for that patients trying to walk and trying to make exercise in a pool. A pool works very good because make the stronger muscles and can contribute to the balance performance. Other thing is you have to be always the grandparents have to be always with anybody. Don't let them alone, because when they're alone, they can go everywhere and can fall down with all that kind of risks. Okay. Okay. Always check how are the vision of the patients, because what I tell you, if the patient have presbycia or have another visual disease, can make an adequate steps, especially when you're using stairways. Stairs are very, very dangerous in patients who have presbycia problem or hypermetropy. They can fall down with all that things. Avoid alcohol can lead loss or coordinations and exacerbate the effects of some medicines, like in fact, cardiovascular medicines can cause arrhythmias and low pressure. They have to check, you have to check that kind of medications and give recommendations for the patients to don't combine with alcohol always. And make your home safer. You have to make your home the most safe place for your grandpa. How to make your home safer? Get rid of things you call trip over and grab bars inside and outside the tub of shower. Always the bathroom have to get that tubs and shower and out the shower. And if the grandpa is older than 80 years old, it's better if you can make the bath with a chair. You can put the chair in the shower, a plastic chair, and they can sit there and you can avoid the risk of fall. Put railings or both sides of stairs. Always there have to be that railings to hold. Make sure your homes have a lot of light always. And especially at night, there are some security little lights who you can buy in some marketplaces, and you put on the plugs near than the floor, in fact, they don't have a switch. They have some movement sensor, and if the people comes and pass in front, they light on, and you can be more safety with that kinds of light. Keep items used that's often in cabinets you can reach easily without using steps or stairs to go there. Use no-slip mats that bathtub and slide surface. Don't slide surface in the shower. It's always good for not just for the grandpas, for everybody. The fall in the shower are very dangerous because you slide and you can broke your hip or your arms. There are more common fractures in that kind of patients. Next slide, please. What do I do if you fall? If you have a fall, it's important to keep calm. Keeping calm has to be a patient, and keeping calm up to being calm when you're the family of the patients. If you're not hurt, that you feel strong enough, if you're the patients, don't not get up quickly. Do it in a slow way. Roll into your hands and knees and look for a stable piece of furniture to sit down, and a chair or a bed, and wait a while. Don't go up now. You can wait a little bit, and then if you make a scanning of all yourself, okay, I'm fine, my wrists are fine, my hips feel good, my head, everything, you can make an honor scan, and if you feel good, you can go up and make the things we're gonna do. Hold the furniture with both hands to support yourself, and when you feel ready, slowly get up. Sit down and rest of a while before carrying or with your daily activities. That's the same thing what I told you before. If you're hard or you can get up, try to get some annotations by calling out for help. Bang into the wall, floor if it's possible. Crawl telephone to ask for help for an ambulance. Now we have some technological devices to help elderly in that things. You have something like a collar, and with some like a GPS, and you can put there, and they make an advice to your family. See if you're in danger. It works very good. And of course, teach them how to use the cell phone and make the speed dials with the emergency telephones. You have to tell, okay, the number one is you can call me, the family. The number two, you can call an ambulance. The number three, you can call your personal doctor. And it works very good because they don't, and when you fall, you don't have to mind how to remember all that kind of numbers in the telephone. Use the speed dial, it works better for them. Next slide, please. Actually, the most common fracture in people who fall are the hips fracture because they need high energy. But I'm going to make a parenthesis with that. A fall in elderly are low energy, but have the same consequences than a high energy trauma, like a car accident in a young people. 55% of people who have a hip fracture have another kind of polytrauma, trauma in the head, or trauma in the pelvis, or trauma in other places. And the hip fracture can cause an avascular necrosis in the 30% of the patients. So if they're intracapsulars, it means inside of the capsula, that's the cover of the joint. If there you have the 30% of risk to have a vascular necrosis, that's your hip are gonna die because they doesn't receive more blood. That's why when you have that kind of fracture, we have to act so quickly, making an urgent osteosynthesis. That is a surgery when you use screws or plates to create the fractures. And it has a non-union of 5 to 30%. It means a lot of people really, because we have more than 5 or 6 kind of hip fractures every week in our city. It means there's a lot of people who have the kind of fractures and with the risk of the complications after this. Next slide, please. This is the next rise of a woman with 75 years old. This is a special tomography, and we can see an anterior plate fixed with some screws because they have 3 kinds of fractures in there. The first one was a diastasis of the pubic symphysis and the pelvis, and a posterior fracture in the joint of the pelvis with the sacrum bone. It's very, very dangerous fractures because there, when the nerves of the legs are coming out of the spine, then we have to fix it. And we can see here a hip joint fracture of the right hip, and we fix it with that kind of intramedullary. It's a nail who comes inside the bone, fix it with the head of the hip joint. Next slide, please. The dislocations are so high energy trauma too. You don't have to take a very, you don't have to do, when you fall, you can put your arms always. This is your first mode of protections. You use your arms, and when you put your arms when you're falling, normally you can make the dislocation of the shoulder or the elbow. Lose the joint relationships, especially in the shoulder, and can cause a damage of the circumflex nerve. You can see there the X-rays of anterior joint, shoulder joint dislocations, and it's an emergency situation. You have to go to ER, and we go there, and with some medications for getting sleep and anesthetic, we can put again the shoulder in the place, and you can go home. Sometimes you have to go to surgery, but they are the less than the 10 or 50% of the patients. Next slide, please. This is awards dislocation. This is a hip dislocations and can make injury of the sciatic nerve in the more than the 8 to 20% of the patients. This is the photograph of an anterior hip dislocations. We call this as a swimmer impact, because when you look at swimmer and in a bad suit and you look like that, they put the legs in that way, and that we call in that way. And this is an anterior dislocations of the hip. Always you have to do the reduction, the put again the hip in the place under anesthesia, always. Next slide, please. And not all fractures can be dramatical. This is a fracture of the knee. You can see, and this is in a scan tomography, and we can see the fracture of the tibial plateau. And this fracture, normally the patient is okay, I have a pain on my knee, but it causes a fracture, and they can cause more swelling or most difficult to walk. And always you have to check the X-rays, and if you don't sure about the X-rays, always please order a scan and look if you have that fractures, and they can be hide in the X-rays, normal X-rays, and you can use in the tomography. Next slide, please. Okay, another thing I want to talk in the special situations before finish. It's about we have in our social environment some situations when you are more than 70 or 75 years old. The sons tell, okay, what are we gonna do with the grandpa? And they tell, okay, we're gonna do that thing. We're gonna divide how to care about the grandpa. And they tell you, okay, I'm gonna take care of him these 3 months. And you're gonna take care of him the next 3 months. And there divides who's gonna care the grandpa at the next times or the grandma. But that's not good. That's not good idea, because always if they change their home, if they change the living places, they forget the mental map of the house. So it means when you're going up at night to go to the bathroom, you have a mental map. So where you're gonna walk to go to the bathroom. But if you change that map every 3 months, you're gonna forget it. And the grandpa coming at night and go to the bathroom and find some tables or some chairs who doesn't are in the map and fall down and have a fracture at the middle of the night. It's so common. Another special social situation is because we have some retirement houses. There's places when you retire, you go and they have a lot of elderly people there. And socially is so common. The grandsons go to some snacks for the grandpa in the visit at the weekends. And they have snacks for the grandpa and for the other grandpas around there because they are their friends. But when they're coming with that snacks, all the elderlies coming up, stand up so fast and go running with the walkers and all the things. Actually, they can run a lot, but they run. And that kind of anxiety, when they have those snacks, make their fall down. And it's so common, the Saturdays or Sundays, we have afternoon 2 or 3 grandpas in the emergency room with a hip fracture because they're running to go to eat the snacks who they give this the grandsons or the sons. I don't know, I think it was an illustration about how common it is for us, that kind of injuries. And we hope you're enjoyed and I'm waiting for your questions. Thank you very much.
Dr. Gomez, would you like to take questions at this time, or are you going to continue with another aspect of your presentation? Dr. Gomez, would you like to take questions at this time, or are you continuing with your presentation?
Hi. No, I think I'm done with my presentation. So if you have questions, you can make now or after, whatever you like. I'm disposable for you.
All right. So I know that we have about 160 people who are in attendance right now. And I'm sure, yeah, it's wonderful. I'm sure they have lots of questions. If you have a question and you would like me to pose that question on your behalf, you can certainly put your question in the chat, or you can raise your hand and you can just click on the raise hand icon and we will allow you, the host would have to unmute you, of course, and we will allow you to pose your question directly. I'm going to remind everybody that if you scroll back in the chat, and actually I'm going to just put it in the chat again right now, that we have posted a link in the chat that allows everybody to click on that form if you are interested in having a direct complimentary consult with one of the medical professionals from FCV Medical Complex in Colombia. And it takes you directly to the form. In the meantime, does anyone have any questions? I will jump things off, Dr. Gomez. I think my question is, in terms of strengthening your balance, it was something that I mentioned at the beginning. And I know that it's really based on statistics. They say people who are over 60 years of age are the ones who are more susceptible to fatal falls. But my question is, in terms of prevention, and I always say the younger the better, right? The younger we start to do the things that are good for us, the better it is in the long run. Should we be looking at in our 20s and in our 30s, should we be looking at ways to strengthen our joints, strengthen our ankles, strengthen our knees, or hip flexors? Should we be looking at things like that really early on?
Well, human being, it's like a checking account. It's like accounting in the bank. So if you make some savings when you're young, they're gonna work when you're old. So if you mere exercise when you're young, you can improve all your muscles and you can improve all your bone density with calcium and collagen. It works very good for the balance when you're old. So people told me, okay, I'm gonna take some calcium, especially the women, after 50 years old when I'm in the menopause. And I tell them, okay, no, that's not the time to eat the calcium. You have to do it before. You have to do it when you're young, because this is your checking account. This is your saving account. Then all the calcium where you get before being in the menopause is gonna work after this. After 50 or 60 years old, all the calcium you're gonna take are gonna go out in the urine, and it can cause, in fact, yeah, it doesn't absorb a lot, and doesn't take calcium work with you don't take vitamin D, what I tell you, and you can activate the vitamin D with the sun. Always you have to go to make some exercise at the sun, at the day, because they activate your vitamin D. And there are another important things. It's called sarcopenia. The sarcopenia, it's the age effects at the muscles. When you're more than 60 years old, the fibers of the muscles are changed by fibrotic tissues and fat tissue. That's why you have to take some collagen. There are some commercial presentations with the collagen, hydrolyzed collagen, and you can take to prevent the sarcopenia. It works very good. But especially, and the first step on the prevention have to be exercise.
It always comes down to that, doesn't it?
Yeah, you have to make all exercise, take a calcium supplement when you're young, and after 50 years old, you can take the collagen, continue with the calcium a little bit, and make exercise. Don't strong exercise, don't make contact sports, but you can make swimming. Swim works a lot. And you can make some things like Tai Chi, what I told you before, or TRX. There's some exercise with some kind of ropes and rubber bands, works very good. Or the just go to walk 45-minute days or 1 hour if you like. But don't forget, always exercise is the younger magical passion always.
Okay, so let me ask you this. And actually, before I pose my next question, Junior has his hand raised. So I'm just alerting the host to look for Junior in the list because we're going to unmute him in a minute. But so my next question is, usually when we talk about exercise, what usually goes directly along with exercise is nutrition. Is there anything that we can add to our diet and nutrition that could help with enhancing and strengthening our core balance?
Yeah, nutrition is very important. It's very important because we don't learn how to eat when you're young, and everybody has to learn how to eat. Nutrition specialists say, okay, when you see your dish, when you're going to lunch, the half of the plate have to be green, vegetables and fruits. A quarter of the plate has to be protein, and the other quarter have to be carbohydrates. And if you do that and you can make a very good nutrition when you're young, you're going to have many more quality of your tissues. And when you're older, it works so similar, and you have to be careful with some how do you say, when you eat some things, we expend many more energy, because you can make some sleepy effect with all that foods, and that sleepy effects can cause falls. Yeah.
Okay, so I'm just alerting the host. Can we unmute? It says user's iPhone. I'm not sure the person's name. If you can unmute that person's microphone, they're registered as user's iPhone. Yeah, so please go ahead with your question or comment.
Hello.
Hi, we can hear you. Go ahead with your question or comment for Dr. Gomez.
Thank you. Good evening. Dr. Gomez, good evening.
Hi.
Could you tell us the importance of fish oil and another supplement by the name of glucosamine chondroitin?
Well, the fish oil works very good because have the omega-3 and omega-6 oils, and they're healthy oils for us. The chondroitin and the glucosamine works for, in an orthopedic view, I'm an orthopedic surgeon, works like a very good pain control, but works no more than the 35 to 40% of the people. 60% doesn't work. So everybody has an aunt in Miami, and that aunt give you always a big jar with cups of chondroitin and glucosamine. So try it. If it works for the pain, you can go and it causes some effects at the joint. But after 3 months, if you take that kind of pills and you don't feel nothing, you don't have an improvement, it doesn't work for you. It's better if you take a very good nutrition and get an exercise every day.
Every day. Okay, fantastic. So we have thank you so much. And then we also have a question. You're welcome. We have a question from Professor Downs, and he would like to know, what type of balance exercises do you recommend? Now, I remember going to my chiropractor, and she had me on one leg and one leg up. And then there was also something called a balance disc, where you had to try to balance that in the middle. So yeah, so that's Professor Downs' question. What type of balance exercises do you recommend?
The disc works great, works very good. In fact, in our patients who have some ankle fractures and joint reconstructions or ACL reconstructions, I always order them at the second time. We have 3 steps of rehabilitations in patients who have that surgery. And the second step was, okay, you have to recover your proprioception with the disc and with another balanced surface. Always you have to recover your balance in stable surface, the floor. After this, you have to recover in unstable surface, the disc or the balance tables. Works very good. And I always tell the patients, go to the swimming pool. Works very good to recover the balance, because you don't have the weight at the pool, and you can make some make stronger your muscles and the strength of the tendons. And when you're walking, not to need swim, just walk in the pool and make you stronger and can recover the balance and the mind rehab to get a walk. Actually, the NASA give the training of the astronauts in pools, because they're similar to that's going to happen in space. So we can go to the space, but we can go to the swimming pools. Do it, and it works very good.
Okay, so now, interestingly enough, your information about the pool, there's a lot more accessibility for Barbadians to going into the sea, into the ocean instead. Would you recommend that equally as good or even better, to do it in the sea in the ocean rather than the pool?
Works very good. The waves, if there are soft waves, you can go with the same way in the pool. It depends of the place where you're going. So there are another situation that's the sand. If the sands are more like little stones, works better because the soft sand make your feet are going down, and you're gonna make more force to get out the feet of the beach. If I don't know if I was clear in that. So the sea works very good. Actually, I want to know how you're going to be your sea.
Okay, you to the question that you answered earlier.
Down, and you're going to make more force to get out the feet of the beach. If I don't know if I was clear in that. So the sea works very good. Actually, I want to know how you're going to be your sea.
Okay, you to the question that you. Thank you. And right, so Dr. Gomez, I was asking, so earlier you spoke to the question of adding the nutritional aspect, and you were talking about what should be on the plate. So someone's asking if you could please repeat the answer to that question. So we've got the exercise on one hand, we need to add the nutrition. What should we be eating more of?
How do you get the nutrition things? Are you asking me? Okay, well, I don't say that. It's some nutrition specialists who say that always. The dish have to be, the half of the plate have to be green as vegetables and fruits. Mm-hmm. Actually, the fruits can give you some energy about the fructose. The fruits have some fructose. So if you're diabetic, you can take all that kind of fruits, but you can take the vegetables, and it works very good. And a quarter, half are going to be green, a quarter are going to be your protein, like chicken without skin, or fish, or meat, if you like it. And the other quarter can be the carbohydrates, as the rice, or 2 potatoes, or whatever you like, but no more than that quarter, because you have to be a healthy food, and a healthy food give you more than 50% have to be some fiber and energy coming from vegetables.
All right, fantastic. So we have Angela Sutton has her hand raised. Angela Sutton, if we could please unmute her mic so that we could have her pose her question to Dr. Gomez. Angela, you are unmuted. Go ahead, please.
Thank you. Good evening. I'm a little nervous. Good evening, everyone. Good evening, Dr. Gomez. I don't have a question as such, only what I would like to say as quickly as I can identify where the falls are concerned, because my mother at 81 years old fell flat on her back, and she sustained what the hospital called a stable fracture of her 12th vertebrae. Mom was in considerable pain, etc. And although she had an X-ray, it didn't show up. The fracture didn't show up until she had the MRI by the Friday. So she actually fell on the Monday, but all this didn't come to light until the Friday. So as I said, she was in terrible pain, and she was in hospital for a little while, etc. But once she was able to get back up on her feet through the occupational therapist within the hospital, it was arranged for her for a 30-week strength and balance exercise class via Zoom, which has not long finished, actually. And we learned a lot from that. She was just at the top of the stairs. She was about to make her step down, but instead of going forward to step down, she fell back. And that's how it all came about. But through all of that, we were able then to transform her bathroom. to just a completely flat surface. She walks in and she showers and so on with the aid of her carers, etc., who come every day. And we've also managed to get in a stair lift for her as well. But she's been pretty fortunate. She's not long finished her strength and balance classes, and that was via Zoom because it was in the height of COVID when she fell to, and they were not able to meet at the church hall and so on. So I can identify well where, as it was said by Dr. Gomez earlier, that fractures don't always show up until she had that MRI. But through the strength and balance classes, she has truly gathered her strength, and she's out and about, getting about, etc. And she does what she has to do, and she's going okay. But if it wasn't for that fall that she had, we would not have. All right, perhaps it should not have happened, but accidents do happen. But we've learned so much, my brothers and I, and so on. And you need to clear the clutter from around the floor. And also, may I say, I am actually tuning in here from England. I'm not in Barbados at the moment. I'm here with Mom, actually, and my husband and so on. Yeah, thank you.
Thank you, Angela. Did you have anything about that, Dr. Gomez?
Well, thank you to share us your experience. It's very illustrative about where we're talking today. And the spine fractures can be stable or unstable. And the unstable fractures of the spine always have to be fixed in surgery. But the stables can be treatment with that kind of treatment who you share us. Then always, this is an experience we can learn about it, because you have to be very careful with surface and try to don't get stairs in the elderly people places, because they don't look that stairs. They're walking and they fall down, and you can take these problems with the spine or the hips or the wrist. When you're talking about osteoporosis, we're always checks that parts. And when you have more than 2 special fractures in the time of a year or less, always you have to start some medications for the treatment of osteoporosis. You have to use not just calcium, you have to use another kind of medications like biphosphonates. They're a new kind of medications. And we have some biological special medications for that. They're injected, and they're very, very good results now. And always, the osteoporosis doesn't have pain. When you have a pain in osteoporosis is because you have a fracture. And you can let the people have a fracture if you can prevent with that kind of medications. It's very important. The doctors, the internal medicine, will see the elderly people can make the diagnosis of the osteoporosis before the fracture.
Okay, thank you, Dr. Gomez. Following up on Angela's comment, and Angela Sutton, thank you so much for sharing that. It's interesting that you also shared with us that you are currently in the UK, because when you were talking about the strength and balance classes for your mom, that was going to be one of my first questions. Is this happening in Barbados? Which is one of the other attendees is asking. They may or may not be classes available, however, and then someone is also asking if there's a falls clinic. There are certainly lots of fantastic physiotherapists on the island. My personal physiotherapist is Gail Weeks. I had a problem with my knee. She was the first person who introduced me to the idea of balance strengthening and the balance disc, which Dr. Gomez seems to also favor. But so there are lots of wonderful physiotherapists. I can personally recommend her because I've been exposed to her care. But it's definitely something you should look into. Another question that we are having here is about a device for if you are alone and you fall. Now, interestingly enough, one of my parents is currently experiencing a medical issue which affects his balance. And now we would have to look into what's available in Barbados. So the options, for example, would be, there's something called Life Alert, where it's a device you wear on a chain around your neck. But again, I don't think that's available in Barbados, because it's a whole system and network that you subscribe to and you pay into on a monthly basis. If you're alone and you fall, you push the button, and the company is alerted. They reach out to you, and they reach out to your loved ones, almost like a medical 911 personal service, right? That's what the Life Alert does. On the other hand, here's another recommendation with a smartwatch. They have Dr. Gomez is shaking his head, so I'm going to get him to weigh in on this. You can use a smartwatch, and it's designed to, it knows if there's a sudden shift in balance, it can detect some of that, and you have to program it to reach out to your loved ones. Dr. Gomez, the smartwatch, is this something that you're aware of that people can use? Older people, if you happen to be alone and you fall and you need assistance right away?
Oh, the smartwatches are a very good device now. I think a problem with the smartwatch is every day are coming more technology and more difficult to learn how to make all the things with all that watch. It's like a computer on your wrist. Then for an old person are going to be so difficult to learn how to work with that every time. Actually, I think the better of the smartwatch they take the dial of emergencies, and you can learn the ground pass. Okay, if you fall, you please press this button and call. No more, and you can go there. And if you can see at your phone, okay, my grandpa has called me, something's happened, I'm gonna go there. But if you are younger, you can use that smartwatch for check your pulse or check your calories, things when you're making exercise. But for all people, it's very good device if you just learn them how to make an emergency call. It works very good, and call the people who always gonna have time for you. But if you have an emergency call of your grandson who lives 2 hours far, it doesn't work. You have to be anybody closer and anybody who can worry about you, a neighborhood or I don't know, a neighbor or a family near than you.
Yeah, well, so I'm glad that people are weighing in, because we don't know everything. So we want you to share this information. I can share with people who are asking that my physiotherapy, therapist, her name is Gail Weeks, and Jenny Smith, one of the participants here, Jenny sharing that they are many of the security companies in Barbados, she's saying they offer a similar service to Life Alert. Jenny, feel free to share in the chat the name of some of these security companies so we can share it with the others. That would be great. And so again, Jenny's saying that some of the security companies in Barbados do offer a similar service to Life Alert. So if you can
Very good.
Chat for everybody so we can see and share that information, that would be great. Here's another question for you, Dr. Gomez. This person is asking if orthopedics are useful or physio. Like, is there a preference in terms of the difference based on your medical expertise? Orthopedics versus physio?
Well, we're a team. You can work with the other. The orthopedic surgeons will always work so close than physical therapists because their rehab are very important. I think it's the same importance for the recovery than the surgery. So the first step are gonna be us. We're gonna make the surgery, we're gonna make the fixation of the fractures. But the real recovery after surgery are gonna be in the hands of the physical therapist. They're my best working friends, and I work a lot with them, and we make meetings so many times because we always have ideas, and the physical therapists always have ideas we doesn't know. We don't know like a doctors. Okay, Dr. Gomez, they told me these kind of patients have to make another different kind of exercise because they have a different way to make recovery. I always learn with them. And I think it's not about what's your responsibility and what's my responsibility. It's about our responsibility because we're a team. And our target are going to be the patients are going to be at the same way before the fall. This is going to be the target.
All right. And so Jenny said she's going to add, she's going to drop into the chat some of the names of the security companies that offer that service. Thank you so much, Jenny. We really appreciate it. Dr. Hunt Cox, hi, how are you? She is recommending Warren's Physiotherapy Clinic. Dr. Phyllis Burnett is also recommended. Thank you very much. And of course, I recommended Dr. Gail Weeks. And we've got another participant who's saying G4S, which is a popular security company in Barbados, that they offer a medic alert system. G4S offers a medic alert system. So what we have to do is get these companies on the BARP list of partners. That's what we need to do. So if anyone, okay, so Cyprian has a question. If we can unmute Cyprian's microphone so that Cyprian can pose his question, his or her question or comment to Dr. Gomez, please, in terms of the host. So Cyprian, just stand by. Cyprian,
Hi.
please go ahead with your question.
Hi, good evening. Thanks, Belle. Good evening, everyone. Thanks, Dr. Gomez, for your presentation, a very instructive one. And we do need to, I'm glad that BARP is actually putting it on. And I do think we need to have more of these presentations around Barbados. We need to actually sensitize our persons or citizens of the issues that concern the golden, as we reach the golden years. You know what I mean? But I want to begin on something though, because I know we're doing a lot here now on the actual after the incident. But one of the things you spoke about earlier, but you alluded to in your presentation, was preventative. And the preventative is very important because we got to make sure that whenever we have an accident, it actually takes away the quality of life from that person. And you know, sometimes we don't want to spend the money up front, but if using Angela's scenario, her actual scenario that happened, her actual accident with her mom, which was very good, and I'm glad she shared that. Had to relocate. She then steer lift. So she actually spent some money. So one of the things we have to do when we're looking at our aging folks, that I would like to advise everyone do as well, is that I don't know what you think about it, but we have to look at the preventative measures we're going to place. And the only way we can do that is if we look then at a risk assessment. The risk assessment can come after we understand the hazards. And you spoke about the hazards. So the hazards would have been the clutter. Most elderly folks are surrounded by clutter. They like a lot of clutter in the house. So they talk about the clutter, the poor lighting. You talk about the toilets when you're getting up and down from the toilet seats, the WCs. You're talking about the staircase. In Angela's case, it was the staircase. So when you recognize that your parents, your family members are aging, or even if they had an accident before, even if they're younger and they have an accident, then you have to then do this risk assessment to make sure then that you can then put the precautionary measures in place. The only way you can achieve this is that if you actually look and do a proper risk assessment. And it is not a difficult task. It's just looking at the hazards out there and how we can mitigate against those things and put those things in place. So my recommendation, and I would like you to weigh in on it then as well, is that to everyone on earshot here now, that actually start looking. I'm glad that we have all the things that can happen after the incident, but let's prevent the accident. And I will say I want to stay here clear that accidents just don't happen. Accident, yes, we have accident, but I don't believe an accident just happened. Accident happened because we are negligent and we don't do the proper risk assessments to make sure that we prevent. Thank you, Belle.
Thank you.
I wait Dr. Gomez's response.
Of course, thank you, Cyprian. So, Dr. Gomez, did you get all of that?
Oh,
got it.
I hear many parts of it. Tell me. Thank you for the question. Okay, I'm gonna turn the light. Better.
Much better. Thank you.
Much better. Okay. Always preventions are gonna have the key to the elderly people. the preventions is, if you, okay, you have to check your home. And after check your home, you can identify who are gonna be the potential dangerous places for the elderly people. Then, normally you have to make clear spaces. That clear spaces reduce the risk of fall, because when you have many furniture in a place, there can be a risk of choking and all that stuff that happens with the elderly people. The most dangerous places at home are two: the bathroom, because we are always wet surfaces, and the kitchen. Why? Because in the kitchen, always people make the food, and some drops of oil are going to the floor. And that little drops of oil can an unstable surface, because you can slip there. You can fall down at the kitchen. So you please tell your parents or your grandpas, stay out of that places if they are alone. If you want to go to the elderly person at home, at the kitchen, you have to go there with him or her. The same things at the bathroom, and there are the tubes of stable tops on the bathroom to hold. When you're in the bathroom, always works for the elderly, but the kitchen are the other dangerous place. And okay, the living room and the bedroom have to be careful, check, because there's something that I didn't tell you. The height of the chairs, of the height of the bed, doesn't have to be many more height or many more lower, because when they're too high, they can fall off the bed. It happens. And when are they so short, you have to try to wake up of a short bed. It's so difficult, because you put your foot on the floor and you try to get up, and you can when you're old, because the forces you make with your abdominal muscles are different than you make with the spine muscles, and you have to make a lot of force, and you can fall down. And that's why, especially when patients will have the surgery of a hip fracture, we tell them, okay, you have to use chairs or beds or places when your hips are going to be open, upper than your knees, always. Not too much, but always upper than your knees. The shoes, what I told you before, you have to check the shoes, and the surface can to be flat, because you can slide and go down, and they have to be comfortable and not too flat, with a little height to make more comfortable and more safely for them. I don't know, all the prevention we can do before the falls are going to be very, very good. Not just medications, not just the appointments with the doctors. You have to be a home care person always. It works very good. I don't know if anything else can
I think you got it. I think you got it. But I actually have a question about statistics.
Yeah.
Do you see more women in terms of falls, or do you see more men in your practice? And this, by the way, is a loaded question.
Yeah.
It is.
Yeah. Actually, we have seen more women.
Uh-huh.
I think women have more risk, because the women are always an activity. Always. You are always an activity. If you're old, the grandma always wake up early to make the breakfast to the grandsons. The grandma always are making some stuff at the kitchen, or making some stuff at the living room. The grandpa don't. The grandpa can be asleep every day and doesn't happen anything. The grandpa can be sit on the porch of the house and doesn't happen anything. The grandma, no. The grandma is always activity and it's always looking what's going on with the family. And it happens here. That's why we have many more risks at the women. And always the osteoporosis are more common in women. It doesn't mean we don't have osteoporosis. We have two osteoporosis to men, but the women are the most risk populations for the fractures for osteoporosis. That's why I think we have a statistic more consults about women than men.
Mm. Interestingly enough, when I thank you for that answer. I wasn't even thinking about that because definitely your answer is around lifestyle as well. And what I was thinking when I said it was a loaded question is usually our footwear of choice for women, because, you know, we like our cute shoes and we like heels, and that doesn't change because you're getting a little older. We still like cute shoes, but often what happens is the footwear is often questionable in terms of safety and risk of falling.
Sneakers I think are very good solutions. The heels are not good. I don't like them.
Okay, what about, actually, I have a question for Angela. Angela, I hope that I see that you're still with us and I hope that you're listening. I have a question for you. You can raise your hand to answer this question and we will unmute your mic, Angela. I wanted to know if, looking at that situation that your mother experienced, and going through, you talked about the balance and strength training that your mom went through in terms of part of her therapy. Did that get you and your siblings into action in terms of, at your stage, you're younger, right? So at your stage, kind of following suit and starting to strengthen on your end as well as a part of your prevention? Angela, are you there?
Good evening. Yes.
Hi. Go ahead. Do you have a question or comment? Hello. If we can unmute Angela's mic, please, so she can sort of speak to that question.
Right. Yes. So,
Did you hear the question?
Good evening. You were asking me a question. Is that what that was?
Yes, I wanted to find out from you, having witnessed what your mother went through, right? And you mentioned the strength training and the therapy that your mom had after her fall. Is that something that fueled you and your siblings to say, you know what, we're going to start doing some of these strength training exercises now as part of our prevention?
Right, I understand, you know. Well, to be honest with you, myself and my two brothers, we are, I would say, quite very fit people. How do I explain this now? I have always been one for exercising anyway. And I always kept up with the exercising. You all have heard of the group called BAMSAC, the Barbados Masters Seniors Athletic Club. Well, my husband and I belong to that in Barbados, and we have been training with them for a good few years. After Mom had the fall and so on, I have always said, as we look at our parents aging, and we see the things that are happening to them, with their illnesses, and in Mom's case now, her fall and so on, I have started to say, you know what? Let us see what is happening with our parents, what it is that they need to do to maintain some measure of fitness, and whatever it is that they need to do, let us follow what they have to do, and what they're doing to keep themselves fit. And as you see them sort of slowly deteriorating, let us see what we can do to keep ourselves up before we get to that kind of stage. Let us see what we could do with the exercising ourselves. And a prime example, I would say, is my uncle Keith. He's in Barbados. And from the time I've known my uncle as a little girl, he has always been exercising, always. And he has kept that up. So we tend to be following him as well. And I just think that as you'll see the decline in your parents, whatever that there is that they need to do to keep going, we must try to double up on that. Because when we get to their age, we want to be able to still run around, still do the things that we would like to do when we were younger. I think you can't sit back and do nothing. You really got to get up and keep going. But I feel that because that we have been relatively fit all up to this age, and I'm in my early 60s, I want to know that when I am in the 80s, I can still do what I was doing at 60 and still be doing it at that time too.
All right. Thank you, Angela. Thank you so much for that.
You're welcome. Thank you.
You. And so, Cyprian, I'm going to bring your attention to your messages. I sent you a message directly, if you're hearing me. And so, Dr. Gomez, any questions or comments or anything that you'd like to add at this time?
Excuse me, I can hear you.
Can you hear me now? Any additional information you'd like to add at this time?
I think it's very good what we have until now. I learned about your experience, and I enjoyed a lot to be here with you.
Thank you very much. And Ashley, we want to thank everybody so much for attending. I will bring your attention once again. If you scroll through in the chat, as a matter of fact, I'll drop it in the chat again for everybody. So that you can have the opportunity, if you like, for a complimentary consultation with one of the medical professionals from FCV Medical in Colombia. Dr. Gomez, I want to say thank you so very much. It was so informative. And I want to say thank you so much to Dr. Barrera as well. And of course, thanks to all of our attendees who were here with us today. I will take this opportunity now to introduce the CEO of BARP, Dr. Glenda Gills. Dr. Gills? If we can unmute Dr. Gills, that would be great. We're still not hearing Dr. Gills as yet. No, we're not. So we're just standing by to do that. Remember, everybody.
Can you hear me now?
Yes, we can. Just a moment, I'll reintroduce you, Dr. Gills. And just reminding everybody, if you are interested, there's a link in the chat that you can click on for direct connection with the FCV Medical Complex in Colombia. And it's just an easy click that's online. And now we're going to hear directly from Dr. Glenda Gills, who is the CEO of BARP. Go ahead, Dr. Gills.
Thank you, Belle. Thank you, everyone. Good evening. Buenos tardes a todos. And that's all I know. On behalf of the directors of BARP, we want to sincerely thank FCV Medical Facility for presenting this afternoon a very interesting, instructive, and thought-provoking topic, the impact of falls. And of course, we covered the prevention of falls, which I think is extremely important because as we were told as children, an ounce of prevention is worth £1 million of cure. And so therefore, this evening's presentation by Dr. Gomez and Dr. Barrera was certainly instructive in telling us what we should do. And we talked about our parents and grandparents. And I said to my colleague, but we are the grandparents now. So we have to be mindful of what we do. We like to keep mementos, and I wouldn't say clutter, but we like to keep things around the house that reminds us of the past. But we also have to be mindful that when we do that, that we are not creating hazards for ourselves. I myself, on a personal note, this evening's presentation is very personal to me because my sister undergoes surgery tomorrow for a fractured hip from a fall that she incurred just a few days ago. And It's very simple happening, not expected, but just one simple movement, and she was in tremendous pain. So I want to thank Dr. Gomez for the tips that he would have presented to us. I also want to thank you, the participants, for sharing your comments, for sharing your experiences, and for sharing your suggestions as to how we can prevent falls. I want to thank everyone for making this presentation possible, and thank you, the most venerable host, bell holder, for moderating this evening. Thank you, everyone. Muchas gracias a todos. I also know that. Thank you, and have a good evening.
Thank you so much, Dr. Jills. And while I have everybody here, I will remind you that, or let you know rather, mark the date, save the date on your calendars. Coming up on Saturday, May the 28th, BARP will be out and about in the community. We're going to be heading to Sky Mall. We are going to have a members fest. That's coming up on Saturday, May the 28th at Sky Mall from 10 a.m. until 5 p.m. And it's an opportunity to learn more about why you should become a member of BARP if you haven't already done so. And remember, anyone from 40 and up, celebrating your birthday from today, happy birthday to you. And so 40 plusers, those fantastic 40 plusers. So everyone from 40 to 140 are now eligible to become members of BARP. And if you would like to sign up on that day, you can do so. Come on out to Sky Mall. It's going to be fun as well as informative. And if you want to renew your membership and it's convenient for you to pop by Sky Mall on Saturday, May the 28th, you can do that as well. And here's why you should also do it. Because there's going to be an opportunity to win. That's right. We're going to be giving away a dehydrator, and maybe I can convince them to give away 2 dehydrators. We'll see. And it's a wonderful opportunity for you to win. It's a fantastic thing to add to your health regimen because it's a way to dehydrate your fruits and veggies and turn them into wonderful snacks in a very healthy way. And so an opportunity to win. So the date, once again, is Saturday, May the 28th, and that's from 10 a.m. to 5 p.m. We're going to be heading out to Sky Mall for a members fest, an opportunity for new members to sign up, and an opportunity for you to renew your membership as well. If you want more information about the members fest, remember you can call 538-2277. That's 538-2277. You can also email us at info@barpbb.org. Or, of course, you can check our social media for details. Those details will be released very, very soon. Also, make sure that you tune into Bringing It Home with BARP. That's our radio show. It's an opportunity to connect directly with you. You can check us out on Q100.7 FM on Mondays, and on Tuesdays on Starcom's VOB 92.9. Thank you guys so much for tuning in today. My name is Belle Holder. On behalf of BARP, on behalf of the President, Marilyn Rice-Bowen, and all of the members of the board, all members of the organization as well, thank you so much for being a part of it. Thank you so much for tuning in today and posing all of your questions. We want to say a special thank you to our counterparts in Colombia. Muchas gracias for being here today, and we really appreciate all of the information that was shared. What I'm going to leave you with, everybody, is if there's something really important that we learned today, put it into action right away in terms of looking at your surroundings. As soon as you click off, take a look at your surroundings and see where there are possible pitfalls that you could actually prevent falling in the first place. Put it into action today. Don't wait, because your health is the most important thing. My name is Belle Holder. It's been my absolute pleasure being here with you this evening.